Oklahoma has one of the highest overdose rates in the nation, with nearly 3,000 unintentional poisoning deaths from 2007 to 2011 alone. Over the years, these numbers have just rose and continued to get bigger and bigger without anything truly being done. But now, as a state and a nation, we are really cracking down on the policies and rules and regulations when it comes to filling these opioid prescriptions. With overdoses coming to the news, front line of the news every single day, I think it's important to know as an individual what policies and rules we have in place to help with this. Walmart and Sam's Clubs, as a company, has really cracked down nationwide in hopes of helping with the epidemic. They will only fill up to a 7-day supply of anything that's not classified as a long-term chronic condition, which is like surgery, or they have been in the hospital on it, or cancer patients. So they're not being deprived of what they need, but they're really cracking down on the people who don't truly need it. Also, the company will not allow more than a daily dose of 50 morphine milligrams. With big name companies cracking down, smaller companies and hospitals nationwide have really joined the efforts. Now, what is an opioid? Prescription opioids are pain medications that include oxycodone, hydrocodone, morphine, among others, which can potentially help you tremendously, but also cause serious threats as well. So what do we do when it comes to monitoring who gets the prescriptions and where they get the prescriptions? There's a new thing being put in place called PMP, which is Prescription Monitoring Program. Anybody in the state of Oklahoma, and nationwide as well, use this program to check where these prescriptions are coming from. So if a patient brings it up to a pharmacy, then the pharmacist or technician can check and see where has this person got this before, have they got it before, how much they got it for, and who wrote the script here in Oklahoma. And not only can they do that here, but they can check surrounding states as well. So in southwest Oklahoma, you can check for Texas too, because there's people called what we call border hoppers, and they go to Texas and they'll go to an emergency room and get a prescription for narcotics and get it filled there. And then they'll come up here and go to an emergency room, get a prescription for narcotics and get it filled in Oklahoma. But with PMP, it's really stopping the people who are able to do that and who have been doing it for many, many years. And another big thing that it comes down to is education. Just like anything in life, you have to be educated to know how to do it right. So pharmacists, once again, and pharmacies are cracking down and telling people and letting them know in extensive conversations and follow-ups about what these pills do and how and what they are supposed to be treating. Also, they're educating people on how to properly dispose of them. There's something called a Dispose RX that many pharmacies have been using, but now have been using a lot more, that create almost a jelly type thing in the remaining pills so you can safely discard of the medications. Once again, education is key when it comes to keeping these medications off the street. Also, there's still going to be prescription drop-off points at like fire stations and police stations where people can safely bring remaining prescriptions there to keep them off the streets. Also, with pharmacies cracking down, hospitals are cracking down as well. They're really having a limit and really specify on who they're going to give these medications to. They can only give them to the people who really need them because so many people are abusing the system now. So hospitals also have a kind of PMP where they can check when and where and how these people have gotten these medications, and to know how to further treat these people and if they need to be on these medications for long term. Just like I stated earlier, education is key. In everything you read about this, education was the most important thing. We must teach the people about this epidemic and how to help treat it. Thank you.